Call the honourable member for Lyne.
Thank you, Mr Deputy Speaker. Look, the opposition here appear to think they have a mortgage on doing anything good in the health portfolio, and I'd just like to remind the House and Mr Deputy Speaker of their track record. Like they did with the Treasury portfolio, where they inherited a $20 billion surplus and $45 billion in the bank, at the end of the June quarter there were $319,473 billion of government securities for the nation to pay back. So their legacy of health, apart from what they alluded to before, is a lot of ballooning bureaucracy, a lot of broken promises and incredible waste. The previous speaker mentioned the wonderful Medicare locals. They inherited a $1.8 billion budget, and they managed to spend 40% of it on bureaucrats and buildings. Shame. And the network of divisions of general practice were just washed away and consumed into this overwhelming bureaucracy. At the opening of the one in my electorate, when I was a practising doctor, the CEO of it walked in and said, "We've got a $20 million budget. We'd like you to tell us what we should do with it." I mean, talk about too much money and no idea. That was just a classic Labor Party thought bubble. But the thought bubble grew so big it was $1.8 billion thought bubble. Not only did they increase that bureaucracy, there were another 11 other bureaucracies and a 27% increase in bureaucrats. 64 GP super clinics were promised. In my electorate, in the town of Port Macquarie, we've had a super clinic there for over 20 years, and there was no government grants involved in that. From when they made a promise and allocated $7.5 million for a super clinic in Port Macquarie in 2010, 2 private ones have been designed, built and operating for 3 years, and the $7.5 million is still involved in turning an old hotel that was turned into an old nursing home into a whole new super clinic. So 4 years later, all that capital tied up, and the health budgets, imagine what drugs we could have approved and paid for rare diseases or for groundbreaking cancer treatments with $7 billion, let alone the $650 million program. They attacked private health insurance at every opportunity. Trouble is, Mr Deputy Speaker, there's 11 million people in the country that depend on it, whether they were removing the indexation, introducing means testing or removing the lifetime health cover rebate. They introduced the co-pay system for the pharmaceutical benefits scheme. They've been supporting it for 25 years, and now when we're trying to keep it sustainable by increasing the cost by 80 cents for a pensioner or $5 for non-concession holders, they're opposing it. That's right. So it's gross hypocrisy. This MPI, this matter of public importance about health, we have the Shadow Minister for Health walked out when it all started. Right. At least our Minister for Health, our Minister for Health stayed here. We have an Assistant Minister for Health, Fiona Nash, who resides in the other place. That's the only reason she couldn't be here, because she's a senator. And she does a damn good job. She's grown up in the regions. She knows what it's like. So what are we doing about it? We're making the health budget sustainable. Health funding has been increased from $64 billion in 2013-14 to $75 billion by the end of 2017-18 budget. In New South Wales, for instance, it will increase each year from $4.6 billion 2014-15 to $5.9 billion in 2017-18. Look at the Medical Research Future Fund. You know, that will be a great legacy for the country. The clever accountants in the Labor Party pulled a Swifty on the medical research community and withdrew $400 million in 2011 by funding things in arrears rather than prospectively. How sneaky can you get, trying to make out you haven't cut anything but move things round in the budget, and bingo, you've saved yourself $400 million. They're all going quiet now, aren't they? Now, we are trying to make Medicare sustainable. It's gone up 122%. 122%. We have to make it sustainable. Thank you,
Order.
Mr
The
Deputy
honourable
Speaker.
member's time is expired. To call the honourable member for Bendigo.
And I'd also like to highlight the appalling speech made by the